Welcome back. I am Dr. Kaban, and this is part 2 of Chapter 25's presentation on fluid, electrolyte, and acid-base balance. This video presentation is on Lesson 25.2, Acid-Base Imbalance. This is an overview of the content that is covered in your textbook, so please be sure to read the text chapter in its entirety. Upon completing your reading assignment of the chapter and previewing this presentation, you'll gain the following knowledge. You'll be able to state the main signs and symptoms of acid-base imbalances, and then you'll be able to bring the following knowledge to the clinical setting practice. You'll be able to identify patients who might be at risk for acid-base imbalance. Acid-base balance is important in maintaining homeostasis. This is because cell enzymes can function only within a very narrow range of pH. pH is a measure of the degree to which a solution is considered to be acidic or alkaline. Normal pH range is 7.35 to 7.45. Death may occur if the pH level is less than 6.8 or greater than 7.8. There must be a balance between bicarbonate and carbonic acid. Bicarbonate is an important substance in maintaining acid-base balance. The normal range of bicarbonate is 22 to 26 milliequivalents per liter. The major function of the alkaline electrolyte is the regulation of the acid-base balance in the body. It acts as a buffer to neutralize the excess acids in the body and maintain the bicarbonate to carbonic ratio at 20 to 1. The kidneys selectively reabsorb or excrete bicarbonate to regulate serum levels and help maintain acid-base balance. For the serum pH to remain within normal range, again, the normal range is 7.35 to 7.45. The ratio of bicarbonate ion to carbonic acid must be 20 to 1. If one component of the ratio changes, the other must change proportionately to maintain this proper balance of serum pH. There are 3 control mechanisms for pH. The first one is the blood buffer system, which consists of weak acids and weak bases. These buffer pairs can act quickly to stabilize the serum pH. The second control mechanism for pH are the lungs. In the lungs, the hydrogen ion and bicarbonate ion dissociation reaction can be reversed, and water and carbon dioxide are reformed. The third control mechanism for pH is the urinary system. In the kidneys, enzymes promote the dissociation of carbonic acid to free hydrogen ions, which can be excreted in the urine. Let's review acid-base imbalances. There are 4 types of acid-base imbalance. This is demonstrated to you in your textbook on page 448, table 25.5. Please refer to this table. An increase in hydrogen ions results in acidosis, which is a decrease in pH. A decrease in hydrogen ions results in alkalosis, which is an increase in pH. Imbalances may be considered acute or chronic. When an imbalance occurs, the lungs and kidneys try to compensate by working to bring the pH back towards normal limits. Let's review the imbalance known as respiratory acidosis. Respiratory acidosis is when there is an increased carbon dioxide levels. This can occur among individuals with respiratory illnesses or diseases, such as airway obstruction, individuals with pneumonia or asthma, patients who have acquired chest injuries. Some who may be taking opiates may experience respiratory acidosis due to the suppression of respiratory rate. Also, individuals with chronic obstructive lung disease, such as COPD, may experience respiratory acidosis. An excessive loss of bicarbonate ions or an increased production or retention of hydrogen ions leads to metabolic acidosis. The loss of bicarbonate ions with diarrhea, for instance, is only one cause of metabolic acidosis. Metabolic acidosis occurs when large amounts of acids are produced within the body. Major causes of metabolic acidosis include kidney disease, diabetic ketoacidosis, circulatory failure, as well as individuals who are in the state of shock. So now let's talk about respiratory alkalosis. So respiratory alkalosis results from patients who experience hyperventilation. Hyperventilation is a rapid respiratory rate. It is usually caused by anxiety, patients who have high fevers, or individuals who have may overdose on aspirin. Also, some head injuries may also lead to hyperventilation. Metabolic alkalosis is when the serum pH is greater than 7.5. Some common causes of this imbalance include vomiting, gastric suctioning, excessive antacid consumption, diuretic therapy, as well as potassium deficit. Again, please take a look in your textbook on page 448, table 25.5, and familiarize yourself with these common acid-base imbalances. Let's review some questions together. Question 5. Terry's patient is critical. She has poor circulation, uncontrolled diabetes, a history of renal failure, and diarrhea. She is at high risk for which acid-base imbalance? Is it A, respiratory acidosis, B, metabolic acidosis, C, respiratory alkalosis, or is it D, metabolic alkalosis? Take a moment to consider your response for this question. The correct response is B. Terry's patient is at high risk for developing metabolic acidosis. Remember, this is because the patient has poor circulation, she has uncontrolled diabetes with a history of renal failure and diarrhea. All these conditions cause metabolic acidosis. Let's move on to the next question. Question 6. You have an anxious adult patient who is experiencing respiratory rate of 45 breaths per minute. The most appropriate intervention that you could do is to instruct your patient to do what? Is it A, sit up, B, breathe through a rebreather mask, is it C, lie down, or is it D, pant with mouth open? Again, this patient is experiencing respiratory rates of 45 breaths per minute. What would your response be for this question? The correct response is B. You want to have your patient breathe through a rebreather mask. Remember that anxiety can lead to hyperventilation, causing respiratory alkalosis. The treatment for this would be to have your patient breathe through a rebreather mask. If you're in the home care setting, the patient can be asked to breathe into a paper bag. The end. This concludes my presentation on Chapter 25, Fluid, Electrolyte, and Acid-Base Balance. Please be sure to review Part 1 of Chapter 25's presentation as well and read the chapter in its entirety. Thank you.